Today we are going to discuss blood pressure. This is really important for everybody for multiple reasons. One, it's just important to know your blood pressure and what those numbers mean. And then also with pulmonary patients, it is likely that they can put you on a blood pressure medication depending on your disease process. And so it's important to kind of know what you're watching for. So for blood pressure, we go to the doctor or you guys come here and we give you two numbers and we're like, yeah, that looks great. Or we tell you otherwise. And a lot of people don't know what those numbers mean. So for your systolic, which is your top blood pressure number, that is the amount of pressure being exerted against the artery walls when your heart contracts. So essentially, how much force is your heart contracting with? How well is it pumping that blood out? The bottom number is the pressure exerted against the artery walls when your heart relaxes. So again, how well is your heart relaxing, or how well is it relaxing and refilling with blood? That's what those two numbers mean, and that's what we kind of look at. Now, when we take your blood pressure and we're talking about diagnosing hypertension or hypotension, we are looking at those when you are resting. So you need to be fully rested, which is about 5 minutes for us to be able to determine that. And it's not a one-time thing. So if you've had high blood pressure once, that's not what we're looking at. What we're looking at is if you've had high blood pressure consistently. That is where we want to really pay attention to getting you treatment or helping bring that down in some way. So what blood pressures are we looking at? What is considered normal? So anything 120 over 80 or less is considered normal. Both of those numbers have to be below 120 and below 80 to be considered normal. 120 to 129 and less than 80, so again, that and word is in there, that is considered pre-hypertension or elevated blood pressure. This is where your doctor is going to encourage you to do some lifestyle changes to get your blood pressure down into a normal range again, along with continuing to monitor it. And then 130 to 139 or 80 to 89. So that word has changed. Anywhere in those two ranges, you're considered high blood pressure stage 1. And this is, they're going to do a risk stratification or risk evaluation on your risk of having a stroke or a blood clot based off of your high blood pressure. And depending on if you're high risk or not, they'll start you on some medications along with those lifestyle changes. And then anything greater than or equal to 140 or greater than or equal to 90, that is considered high blood pressure stage 2. This is where they're going to start you on usually 2 medications to bring that blood pressure down, along with continued monitoring and encouraging those lifestyle changes. So what do I mean by lifestyle changes? What am I talking about? So the non-pharmacological changes to help bring your blood pressure down are going to be weight loss. So it doesn't have to be a lot. Even 5 to 10% of your body weight lost can make a huge difference in your overall health. So just a little bit of weight loss can make a big difference, especially in that midsection, because the more adipose tissue you have in your middle, the more pressure is being pushed on those internal organs, which is increasing that blood pressure and the workload on your heart. A healthy diet, especially considering sodium, so it's also listed on there, reducing your sodium intake. When you have high blood pressure, we're looking at 1,500 milligrams or less is considered a normal range for sodium intake in somebody's diet. So a healthy diet is, healthy choices going to be really helpful because most of the sodium that you're going to find is in processed foods or prepackaged foods. So trying to kind of work away from that and doing a little bit more of your naturally found foods, your fresh foods, because sodium is used as a preservative, and where salt goes, water follows, and that's going to increase your blood volume, which increases your blood pressure. Physical activity, so that's another one that we like to push a lot here. Exercise is a natural vasodilator. So what that means is it opens that tube. So your arteries just makes them bigger, which allows the pressure to go down. So if I have a tube this size and I have a tube this size and I have the same amount of flow going through them, this one is going to have a lower pressure in it. So that's why a lot of times when we check your blood pressure after you're done exercising here and you've rested, it's usually lower than where you started. And that's because those arteries vasodilated open and allowed that blood pressure to come down. And it'll usually stay low for up to 24 hours after exercise, which is why we encourage daily exercise, or part of the reason. Increasing your potassium intake can help lower your blood pressure, and moderation in alcohol can also lower your blood pressure. So that's considered 1 alcoholic beverage a day for women or 2 for men. We are, I'm not saying 1 drink, okay, that's not a drink. 1 drink would be considered 12 ounces of beer, 1 ounce of 80 to 100 proof liquor, or 4 to 5 ounces of wine is considered 1 alcoholic beverage. And you cannot save them up for the weekend. It's a use it or lose it. So if you didn't drink them that day, you don't get them. And helping keep that in moderation is going to help lower your blood pressure as well. And then stress. So when you're chronically stressed, your blood pressure is going to increase. That's a physiological change in our body from stress. And when that happens, your blood pressure will be chronically elevated. So we want to make sure that we're managing our stress. So most common medications for high blood pressure are going to be diuretics. So a diuretic helps rid your body of that excess fluid. These are going to be things like Lasix, furosemide, torsemide, those medications. These, however, will only work if you're adequately hydrated. So a lot of patients will get on a diuretic and they will stop drinking as much water because they don't want to have to pee that often. But this actually ends up making it so the medication does absolutely nothing for you. So you need to make sure you're still drinking lots of water so that medication can pull the excess fluid out of your tissues to get it out of your system and help lower that blood pressure. ACE inhibitors, these are going to be things like lisinopril. These help relax and open your arteries. And then calcium channel blockers are going to reduce the heart's contraction. So how hard your heart contracts or how forceful it is. And those are going to be things like losartan. So all of those can lower your blood pressure. Your doctor can put you 1, 2, or all 3 of them if they think they need to, any of the combinations. So why is this important? 1 out of every 3 Americans over the age of 20 has high blood pressure, and 1 out of 6 of them does not know they have high blood pressure. The reason for that is you won't know you have high blood pressure unless you're checking it regularly. Because like I said, it's not 1 number, 1 high. It's consistently high over a period of time is considered hypertension. So you don't know that you have hypertension unless you're getting it checked regularly, because most people don't go to their doctor except for once a year unless they need to for some reason. And hypertension, because it has no symptoms, we call it the silent killer, because it can have major effects on our system and cause more heart disease and increases your risks of strokes. So getting that under control is really important. We kind of talked about the things that can cause that. Other things, along with what we've discussed, as far as the non-pharmacological changes, those are all, if you look at the opposite side, things that can increase your blood pressure. Other things are excessive caffeine intake. So coffee, teas, sodas with caffeine in them, those can all increase your blood pressure and your heart rate. And then smoking can also increase your blood pressure because it hardens the arteries and constricts those arteries down. So vasoconstricts, which is the opposite of what we want because that increases your blood pressure. Now, hypotension is considered anything 90/60 or less. And we generally say the lower the better unless you're symptomatic. Symptoms are going to include lightheadedness, dizziness, excessive fatigue, slurred speech. Any of those symptoms are considered low blood pressure or symptoms of low blood pressure. And if you are below 90/60, you are in a hypotensive state. This is most often caused by dehydration. Patients aren't drinking enough water. So make sure you're drinking lots of water to help get that blood pressure up again. Other things that can cause it are medications, certain endocrine problems, heart problems, excessive bed rest. Nutritional deficits can cause low blood pressure. And then, like I had talked about with medications, pulmonary patients can be placed on blood pressure medications even if you don't have essential hypertension. So if your blood pressure is not generally high, you can still have what's called pulmonary hypertension. Those two things are completely exclusive. Just because you have one does not mean you have the other. So sometimes you can have a perfectly normal blood pressure when they're checking it, but your pulmonary arteries in your lungs can be hypertensive, so constricted down. And your doctor may put you on a blood pressure medication because the blood pressure medications that affect your essential hypertension will also help with pulmonary hypertension. However, if you have normal blood pressure and get put on one of these, you can go into a hypotensive state and go too low. So you definitely want to make sure you're checking your blood pressure regularly, even if you don't have normal high blood pressure and you're on one of these medications, to make sure you're not going too low. And if you are, reaching out to your doctor and discussing that with them. So how do you monitor your blood pressure? One, you want to make sure you're sitting for a full 5 minutes. Don't get up for any reason whatsoever. So even getting up to throw something away and then coming to sit back down, that's considered exertion, which is going to falsely elevate your blood pressure. So sitting for a full 5 minutes with your feet flat on the floor, don't cross your legs because there's an artery behind your knee that when you cross it gets kinked off, like kinking off a tube or a hose, and that increases that blood pressure. You're going to have your arm at heart level, so just relaxed out. That's why we hold your arm in place and we tell you to completely relax your arm to help make sure we're getting an accurate blood pressure, because when you hold it up, the muscles in your arm are going to constrict around those arteries and falsely elevate that blood pressure. So fully relax that arm when we're checking it, or when you're checking it at home, having it rested on a table. You want an arm cuff if you have one. The wrist cuffs are no longer recommended by the American Heart Association because they're less accurate. If you have one, you can continue to use it. But if you're looking to get a new one, or you're looking to get your first one, I highly recommend getting a arm cuff or a bicep cuff. And then with those resting on a table, and you're going to check it at heart level. If it's too low or too high, you're going to get false numbers. If you are using a wrist cuff, you're going to bring it across your arm or across your body, and then use your other hand to hold that arm in place so you can completely relax this one to get an accurate blood pressure that way. If you have a blood pressure cuff at home and you're not sure if it's working correctly because we're always getting a different number, or you're just not sure, you can bring it in and we can check it against what we're getting. We can't calibrate them, but we can verify if they're working correctly or not for you. And then finally, what do we want your blood pressure to do when you're exercising? So we want that top number to come up. That means that your heart is contracting harder, which is getting more blood out to those muscles and organs that are demanding more oxygen and more blood flow because they are working. So we want your top number to come up by at least 10 points is our goal in class. And then we want that bottom number to stay the same or come down. And that's how well your heart is relaxing. So if that bottom number is starting to creep up, what's happening is your heart's not relaxing as much, which means it can't fill with as much blood. And when that happens, you are likely to pass out if it gets too high. So we don't want that bottom number to come up. Our limit is usually by 10. We don't want it to come up more than 10 on that bottom number. So that is what we're looking for when you're exercising, to know that your blood pressure is responding appropriately. The number one reason the top number usually doesn't come up is, again, dehydration. So we'll usually have you drink some water. If it's still not coming up, it could be because you're working too light, or it could be you're working too hard. So if you feel like you're working at a really hard effort and your blood pressure is either staying the same or coming down, you may be working harder than what your heart can tolerate, and it's just not able to keep up with that, in which case your blood pressure won't respond appropriately. So if you have any questions, feel free to ask. Otherwise, have a great day.